My friends, you are most welcome to Uganda, the power of Africa. My name is Mike Bogere, born and grown from deep in the village. I started Loy Clinic Uganda in September 2008. From a humble beginning, sleeping on a sofa at a friend's house with the help of volunteers, we struggled to slowly build, always charging those patients who can afford it, but not those who cannot afford treatment. Women face so many challenges in Uganda. Men can have many wives and too many children that they cannot support. When they reach their teenage years, girls turn to older men who promise to pay their school fees in return for sex. This promise is rarely kept. Instead, a girl becomes pregnant, drops out of school, and faces the same fate as her mother, uneducated with too many children, and a husband that cannot support them. If she's lucky, then her husband won't abuse her or infect her with HIV. There are so many women struggling to keep their children safe, to keep them healthy, mostly just to keep them alive. Here at Ranjava Learning Site, there is a whole town filled with abandoned women and children. With no money, they have constructed their mud houses on government land. It is a precarious life, and they can be removed at any time. If a woman had any choice, she would not keep her family here. The lake acts as the latrine, as well as the place to keep drinking water from, and fish for food. Dysentery is too common. Loyal Clinic is the nearest health clinic, but at 10 kilometers even we are too far. Transport to reach the clinic can cost £5, more than these people make in a week. Of course, they do everything to save their children, but when their children have severe malaria or dysentery and they cannot reach us, then they will die. We could be helping more people. With an ambulance, we could reach people in the rural areas so that the kids don't have to die of malaria, so easily treatable when it has been diagnosed. Then, dear friends, when you visit this beautiful, fertile country, you can stop by and see how we have changed those lives. When you move distance from the road, there people are suffering. And when you go deep the village, it is worse. When you go to the islands, it is worse. So those are the people we intend to reach out and get our services.